Virus first detected in China could be brought to the Bay Area.
Yeah, SFO, one of 3 U.S. airports adding extra health screenings for passengers arriving from China. KPIX5's Andrea Borba joins us now with those details. Andrea?
Well, Ken and Veronica, this includes SFO, JFK in New York, and LAX in Los Angeles. If passengers are exhibiting symptoms of this virus, they will be taken to a local hospital and not their final destination. If you thought customs lines at SFO were bad, they're about to get a little worse, as passengers arriving from Wuhan, China will be screened for novel coronavirus.
Connecting or nonstop passengers from Wuhan would be diverted to a separate area inside the customs facility where they would go through this interview and screening process with CDC officials.
Dr. William Schaffner, an infectious disease specialist from Vanderbilt, says the passengers will fill out a questionnaire and have their temperature taken. He says it's the same type of virus as both the SARS and MERS scares a few years back.
Capable of causing serious lung disease. It's sickened over 40 people so far, 2 of whom have died.
This virus is believed to have originated at a fish market in Wuhan. The screening process at SFO, JFK, and LAX will be complicated, according to Dr. Schaffner, for this reason.
You and I know we're in the middle of influenza season, so flu can give you a little bit of a fever. So nobody knows yet how many people are going to be asked to step aside for further examination.
There are 3 direct flights a week from Wuhan to SFO, each with 150 passengers on board, and a handful of other passengers not flying direct.
At SFO, we think that connecting number is probably about 10 to 25 passengers per day.
The Centers for Disease Control is in charge of the screening. Passengers are both leery of the wait and the virus.
I don't want the virus to affect my family or myself or take time out of people I care about.
It's very important to be able to screen out any type of viruses, especially airborne or anything that's coming into the country. I just wish that we'd figure out a better system to do it.
Now, the first flight from China Southern Airlines into the U.S. under these new guidelines is expected to land at JFK tonight. Another will land here at SFO tomorrow morning around 1 in the afternoon. After that point, the CDC expects to expand this program for about 2 weeks, possibly expanding to 4 more airports across the United States. Live at SFO, Andrea Borba, KPI.
Passengers arriving at LAX from Wuhan, China will be screened for a potentially deadly disease. Here's a live look at LAX. This all comes amid heightened fears that the coronavirus could spread here. The disease is already gripping parts of Asia. This newly evolved virus has already sickened dozens of people. It has killed 2. The disease has also been discovered in Thailand and in Japan. At least 2 people there had recently traveled to Wuhan, which is now considered the epicenter of the outbreak. About 100 CDC workers are going to be deployed to help the staff here at LAX, as well as San Francisco International Airport and JFK in New York.
Further confirmation. The outbreak of a new viral pneumonia in China is on the move. A man in his 30s arrived in Tokyo with a cough and high fever. He's now recovering. So too is another traveler in Thailand. Both had visited Wuhan, the Chinese city where investigators confirmed at least 41 people are sick with the mysterious new virus. 2 men in their 60s have died. Investigators say most, but not all of the patients spent time at this seafood market in Wuhan that sells live and dead animals. They're likely the source of this infection. But the question now is, can it spread from person to person? So far, no one knows.
It's really too early to be confident about what the disease looks like.
Investigators say they're dealing with a new type of coronavirus, placing it in the same family as severe acute respiratory syndrome, or SARS, which killed nearly 800 people, including 44 Canadians almost 20 years ago.
If you think about the initial cases of SARS, the case fatality rate was much higher. So it looks like this virus is less severe.
Tokyo, Japan, Taipei, Hong Kong.
Infectious disease doctor Isaac Bogosh can predict where the illness will be detected next. Unlike during SARS, China is quickly sharing information that's also enabling scientists to create tests for the new coronavirus.
It's extremely important that we be wary of infections that might be acquired on distant lands that might land on our doorstep.
In just over a week, Lunar New Year celebrations will see millions of people traveling within China and around the world.
Health Canada says hospitals are on alert and that anyone arriving from an affected country who is experiencing flu-like symptoms should notify authorities immediately. Christine Burak, CBC News, Toronto.
Good afternoon. My name is James Ireland. We at the airports have been aware of this virus a little over a week now. We follow reports, infectious disease reports from all over the world. It came up in China, this issue where it looks like people were infected from a novel coronavirus, which is a type of virus that causes cold or flu-like symptoms. There's been previous viruses in the past that have been known, MERS, MERS, and SARS from many years ago. And this coronavirus popped up, possibly people were infected from animals. It's a little unclear right now, and whether or not there's human-to-human transmission is also being investigated. But the CDC has now today put this on a little higher alert and a watch level. Although it's they consider a low level of alert, it is still something that's being watched. Now, Honolulu Airport has had a robust surveillance system in place for over 10 years because of diseases like SARS and avian influenza, where it's a team approach. The CDC on international travelers is the lead agency, and they work with the state DOT. We have firefighters here at all the airports as first responders. At Honolulu International Airport, we also have a paramedic from American Medical Response, and then the DOH, the State Health Department, is also involved. And we meet regularly, usually every 3 months, to talk about not only influenza, but emerging infectious diseases from around the world that could come to Hawaii through travelers. And so what can happen then is if an international traveler does come to Hawaii who's ill, again, the CDC is the lead agency, and they can actually quarantine the patient and order the patient into quarantine or medical care. Now, they have, again, the lead on that, but if the person needs medical care, the airport first responders from the fire department as well as the paramedic will then tend to the patient. And if it is a suspected infectious disease, then we would take the appropriate isolation precautions and notify and alert the responding ambulance unit as well as any hospital that would be receiving the patient. And again, with this virus, they're not even sure yet if it can be transmitted between people. That's still being investigated. So it's something that we train for on a generic basis on any infectious disease, and so it almost doesn't matter what the actual agent is because we treat them all the same with the same sensitivity and care not to infect responders or other people in the community. But as far as a vaccine, there's not a vaccine for this. There's not any medical therapy right now, like antivirals or antibiotics that treats this particular virus. It's more preventing the spread.
How would we know if a traveler does have the virus?
Well, right now, as far as I know, there's no rapid test that you could just swab them for. It's something that we need a high index of suspicion, meaning you're coming from this region that has this disease, this region in China. And so that would be, and it could be flu, it could be parainfluenza, it could be other illnesses just be coming from that region. But right now, if you are coming from that region, that's a high index of suspicion that we would have, and then we would just warn, like I said, people who are also taking care of this patient. But the decision to allow entry into the country, to quarantine, any of that is, again, because it's an international traveler, the CDC's call on that. And they do this every day for all travelers coming into Hawaii, not just this particular condition. So even though it's not been reported that they're doing active screening here, they screen every day for all kinds of illnesses and stop people that do have, because people come here unfortunately sometimes with measles, flu, other diseases that are not necessarily common, but when they're exhibiting signs of illness at the airport or on the plane, the CDC is always involved.